Trigger warning, in this video I am going to be talking very openly about cervixes, vaginas and all of that stuff. So if that freaks you out, just move on, but also make sure you and your loved ones book your smear test. My name is Lucy May Walker and I am doing this video today to hopefully encourage more people to go and get their smear test. So before I start, if you are over the age of 25 and you have a cervix, go and book your smear test, your pap test, your cervical screening, whatever you call it. Please go and book it today. And I'm going to tell you my story and hopefully it'll give you a reason why. In the UK, I'm not sure about everywhere else, but in the UK, 6 months before you hit your 25th birthday, you will get a letter from your GP inviting you to go and have your smear test. They call it cervical screening now, but same thing. The reason why we have smear tests is to spot early signs of cervical cancer and hopefully prevent it into turning into that. So, my first ever smear test was at the age of 25. So this is gonna blow my cover on how old I am, but never mind. And let me just warn you, if you've booked a smear test and you have the rush, please ring them up and reschedule. I didn't do that. Really bad idea. Do not have a smear test if you have the rush because it is very uncomfortable and there will be some blood. My second test came around. I got a letter again from the GP telling me my cervical screening test is due. Please book an appointment. I don't know if you're the same as me. I don't like ringing up doctors to make appointments, so I tried to do it online and I booked an appointment, not realising that you have to book it specifically with a nurse. I'm not sure about the US, but in the UK you have to book your smear test with a nurse and they have to know that that's what you're coming in for. I just booked a regular doctor's appointment, turned up to the doctor's and was like, hi, I'm here for my smear test, and he's like, yeah, no, I don't do that. And then I went to the reception on the way out and I booked specifically a test with my nurse. She was so quick, in and out. I felt pretty much nothing, to the point where I was like, she hasn't done it. For me, it's almost like when you book a dentist appointment. You know when you book an appointment and there's nothing wrong, but it's like a checkup. That's how I look at it. I was like, it's a checkup on my cervix and the cervix is going to be fine. I completely forgot about that test until I received a letter in the post on the 21st of January 2020, that great year. I thought it was just going to be like, well done for getting your smear test, see you in 3 years. But it explained that I was HPV positive. I had no idea what that was. So most people get it. Normally you don't even realise that you've got it because it normally goes away. But sometimes it can cause abnormal cells which could turn into cancer. So obviously, like any normal human being, I read the word cancer and freaked out. Also in the letter it said, we also tested your sample for abnormal cervical cells. We found changes called low-grade dyskaryosis, which are normally not cancer, but we want you to come in for further examination. You assume nothing's wrong with you and then just see the word cancer. It's scary. So I was invited for a coloscopy. At this point, I didn't want anyone else to worry too much, so I told very minimal amount of people, but I kind of tried to keep that mindset that this is all like preventative. This is not saying that you've got cancer, but let's just check everything out. This is a good thing. So I go to the hospital on my own, sat down with a nurse, and she was absolutely amazing. Hats off to the NHS. This woman, absolute queen. She was so reassuring and she calmed me down so much that I kind of forgot why I was there. She explained that the majority of people will have a coloscopy, everything's absolutely fine, and then you can go home. And what they do is they apply it's like a black liquid for them to be able to see the cells more clearly, and it comes up on a screen and you can watch too if you want. I did for a bit and then it freaked me out. She was amazing. Chatted away while she was doing her thing, absolutely no discomfort whatsoever. I think I'm pretty comfortable with doctors and stuff. I don't really get embarrassed. For me, it was so chilled out. We were chatting away. I think they were YouTubing me at one point. Again, because she'd reassured me so much that they're probably gonna have a look at it and go, oh no, everything's fine. In my mind, I was like, that's what's gonna happen. And I relaxed so much that when she said, oh, Lucy, I think you're gonna have to have treatment on this, I was like, what's that? Some sort of pamper session in my cervix, lovely. Actually, she meant that it's looking a little bit worse than she thought. So the coloscopy then turned into a biopsy, and a biopsy is where they basically take a little bit of your cervix out and they send it off for testing. She's obviously done a lot of these procedures before, and she kind of very calmly again sat me down and was like, look, just by looking at it, I think you're going to need some treatment on this. And the treatment she was talking about was called LETS. LETS procedure stands for large loop excision of the transformation zone, and it's the most common treatment to remove abnormal cells. LETS involves cutting out the area of the cervix where abnormal cells have developed. This is done using a thin wire loop that is heated with an electrical current. The result of your cervical biopsy has shown abnormal cells. Sin 1, it's unlikely the cells will become cancerous and they may go away on their own. Sin 2, there's a moderate chance that the cells will become cancerous and treatment to remove them is recommended. I was absolutely fine in the hospital, but it wasn't until I got on the bus to go home thinking this is a bit bigger than I thought, and this is probably the time where I have to tell my family. So as I'm texting my parents, I just kind of broke down on the bus and started thinking, oh my god, I could potentially have cancer. I'm quite good at, no matter what's happening in my personal life, I can go and perform and pretend everything's fine. So I decided the best thing to do was go and busk. In hindsight, I should have taken the day off. I got on the train, I had my first ever panic attack. I've never had a panic attack before, and yeah, it really feels like you're dying, doesn't it? I then received the letter confirming that the doctor was right. I had to come in for this LETS treatment. Remember, this is the year 2020, and my small operation was booked for the 20th of March. That was the week that Boris announced that the UK was going into lockdown. If you're anything like me, get to these appointments early. It potentially means you've got more time to sit and be anxious about it, but you also don't want to be anxious about the fact that you're running late. So yeah, we got there 20 minutes early. The doctor literally came, called us in, and he was already in the best mood ever because we were early and we were the first appointment of the day. He was really, really assuring. He spoke to my mum as well, explained that she couldn't be in the room, so she had to go and wait in the waiting room. He was just like the woman I had before. He was so nice. He also said he was like the head doctor in this department, which also was just a bit of more reassurance. He does this 1,000 times a year. You can either have the injection into your cervix to numb it, or you can take the general anaesthetic, which knocks you out. I took the local anaesthetic. The whole procedure was completely painless. That was the only bit. A scratch, as they say when you get injections. The only thing I can remember is the smell of burning. And if you think too much about it, you're like, that's my cervix, but try not to think about it like that. I think the actual procedure maybe lasted 2 to 3 minutes. They do explain to you that there is likely to be a lot of bleeding afterwards for potential weeks. So I had like stocked up on sanitary towels. Again, remember this is mid-pandemic, so it was quite difficult for me to find sanitary towels actually. But I was absolutely fine. I had pretty much zero bleeding at all. So I cannot thank the doctor enough. He was amazing. So this was March. In April, I was getting a little bit anxious because I hadn't received a letter, but I think it was all COVID related and there were delays because of that. I ended up ringing the hospital and asking for the results, and the results came back and it had been Sin 3, which is a high chance that the cells would have become cancerous at some point. Yeah, and then to come back in 6 months' time. And the reason why I'm doing this video now is because 6 months had passed. I went in for another smear test a couple of weeks ago. I got the letter back. They said everything was clear and I don't need to come back for 3 years. Whoo! Sorry. I've tried to film this bit like 5 times. Okay. So I don't have cancer. Okay. I wanted to share my story because I had no idea anything was wrong with me. I had no symptoms, absolutely no signals, and no reason to believe that there was anything wrong with my beautiful little cervix. I could have so easily put booking that appointment off thank my sensible little brain for going to the receptionist and booking it again. A month or two later, we were in the pandemic, so I really think that I would have put it off. I don't know how quickly these things move, but if I hadn't got that smear test in January, this could have been a very different story. So, if you are the age of 25 or older and you have a cervix, as soon as you stop watching this video, please ring up your doctors and ask to book your smear test. If you've received a letter recently saying you're due a smear test, book it. I think a lot of people are assuming that you can't get your cervical screening during the pandemic. That is wrong. In the UK, it's absolutely free to go and get your smear test. I know in the US, it's a little bit different with the healthcare over there, but I'm told if you have insurance, it's pretty cheap. So book it now. If you're worried about it being uncomfortable, let me tell you, nothing can be as uncomfortable as it was when I had thrush and had a smear test, and I still got it done. Cancer doesn't wait for coronavirus to stop happening, it just keeps going. Please take 2 minutes and book your smear test today. And if you're watching this and you have a partner, please go and ask them when their last smear test was and if they're due one. And if they are, please, please, please encourage them to get it done. It is so important. It's so much more important than whatever else is going on in their life. It's an amazing thing that we can do to prevent cancer from happening. So please take advantage of it.